Edwards, for those very inspiring words and reminding us as men that seeking help when we need help is certainly a strength. And also reminding us of some of the focus that the ministry is placing on men's health in the area of public education, early detection, and trying to improve on our figures, men who are coming forward for screening in our various health clinics. So thank you very much. And the Dominica Cancer Society continues to look forward to collaborating with the Ministry of Health in improving the health of our men and by extension, the health of our nation. So thanks again very much. I forgot to recognize my friend and my padre, Monsignor John Lewis, in my earlier introductions. Welcome, Monsignor, and thanks again for leading us in prayer. At this point, I'm going to invite the panelists to join us at the table. We are still missing Dr. Jacob, but we will begin, and he will join us as. So the panelists, can you please come forward? And before passing over to our distinguished panel, I would just like to introduce the moderator for the evening. And our moderator is Carlton Lando, very well-known pharmacist, talk show host in Dominica. He is head of sales, public health, and public relations at Joyce Pharmacy Limited. Carlton is a graduate of the University of the West Indies with an executive diploma in community health, a certificate in advanced supervisory management, and a diploma in public relations. He is currently pursuing a master's in business administration, specializing in coaching, mentoring, and leadership at York St. John University in England. Carlton has won many top regional awards, and I will not try to list them for you here this evening, but I guess many of you may know some of these. And these awards are for his contribution to health education and promotion and pharmacy practice. As you know, today he joins all the pharmacists in observing World Pharmacy Day. You may have heard him in the news this morning talking about that. In Dominica, he holds the position of Vice President of the Dominica Diabetes Association, which is an extension of his community service. As I said, he is the host of two popular health talk shows aired weekly on DBS and Q95 Radio, Health Pulse and Health Vibes, and he is the editor of Jolly Pharmacy Internal Health Newsletter, Health in Focus. Carlton Lando is a husband, a proud one, and a father of 3 children. So I pass over to Carlton Lando to continue the night proceedings. Let's welcome him.
Thank you, Mr. Leader. Good evening to everybody. It is a pleasure to be here this evening. As you know, men's health is everybody's business. As we would normally see, tourism is everybody's business. We are still in the point this evening, and we're saying that men's health is everybody's business. And so this evening, we are going to be focusing on men's health, but more specifically on prostate health, as it is prostate awareness health, prostate awareness month here in Dominica and the world by extension. You would have heard the statistics earlier on in terms of the mortality rate, in terms of men who have succumbed to prostate cancer, and the many men who have been diagnosed and sometimes have been diagnosed too late. And so this evening we are going to really encourage our men to listen. Those of you who are joining us virtually, as we are live on Carrier FM, on Dominica News Online, on uh, Loftus Zero, yes, Loftus Zero Live as well. So we are international this evening. And so we want you to take some time and listen. Wives, call your husband, call your boyfriend, call your brother. Let them know that a very, very important discussion is happening this evening. One that may actually help someone and help someone to make a better choice. This evening, we do have a very informed panel. Dr. Jacobs is running on the list. I just spoke to him. He should be really close to us anytime from now, so he will join us soon. But let me just introduce our two panelists that are here at the moment. Mr. Lester Guy, who is a friend of mine and my very own therapist. And I encourage everyone of us, we need a little therapy at times. So Lester Guy is a health psychologist and is currently coordinator of the HIV/AIDS response unit of the Ministry of Health, Wellness and Social Services. He holds a Master's of Science in Health Psychology and is the founder of GL Services. Lester Guy, let's make him welcome. We have another very good friend of mine. He was the best MC at my wedding, and he never sent me a bill. So it's something I really truly appreciate. Mr. Valentine Coffee, and we normally call it Val, and Valentine Coffee served in both the public and private sector as a pharmacist. He has served as the third and first vice president of the Caribbean Association of Pharmacists. He is co-founder and CEO of Bullseye Pharmacy, Inc. Valentine served as executive director of the Dominica Festivals Committee. He's a former senior cultural officer. He also served as chairman of the Carnival Development Committee and a former president of the Dominica Amateur Football Association. He has worked basketball rather association. He has worked in media, has been road match king in Dominica on several occasions. Many of us remember Through My Pocket, you know, and the list goes on. He has been a DJ, master of ceremonies at numerous events. He is currently in his final stages of studies to becoming a deacon in the Catholic Church. So let's make Mr. Cotton. And we have our third panelist, Dr. Ken Jacobs, is on his way. Dr. Ken Jacobs is a urologist by profession, and he's from the community of Granby. He first entered the medical sector in the year 2003. He has arrived as a nursing student. He excelled in his first year of nursing, and as a result, decided to further his studies in medicine in 2005. He worked as a medical officer in Dominica from 2013 to 2015, then got the opportunity to specialize in the field of urology in Santiago de Cuba, in Cuba. From 2020 to 2022, he worked alongside two Chinese urologists at the Dominica China Friendship Hospital, where he gained even more experience in minimal invasive and endourological techniques. From there, he has been in private practice in his capacity as a urologist and is willing to lend his expertise when called upon. Dr. Jacobs, good evening. So we have a very, very good panel. We are looking at the survivor story, the psychosocial aspect of the diagnosis and the way forward after you have gotten that diagnosis, and the treatment options that are available. What you need to know, what the facts are as it relates to prostate cancer, prostate health. So this morning, this evening, we have had such a long day, but I'm still in the morning period. But this evening, what we will begin with Dr. Jacobs, who is going to give us an overview in terms of what is the prostate, what are its functions, what are the signs and symptoms that you would need to look for, and so forth. And so we will ask Dr. Jacobs to actually come and make his presentation to us. The mic actually can move, so if you want to sit or if you want to stand, you can sit. Yeah. So,
Hello, good evening. Good evening. I'm Dr. Ken Jacob, urologist. May I can speak to the country this evening about prostate health. Okay. Going to your prostate health, we have to know what exactly is the prostate. Prostate is basically a small organ underneath the bladder for the only venous have prostate. Women do not have prostate. Okay. So it is behind the pelvic bone. So that bone you feel just with your belly button, just above the penis, that hard bone. It's an organ below here at the back of the bone. It's a walnut-shaped organ. If you do not know what a walnut, we can describe it as a small green line about 30 millimeters or 30 cc's. Okay. Now, the prostate, the function of the prostate is to help nourish the sperm, which form part of the semen. So it produces the liquid that forms part of the semen. The prostate produces fructose and other substances that nourish and protect the sperm so they can swim along the fallopian tube to fertilize the egg in the female. Okay? So now when the man hits the age of 45 to 50 years old, we have some hormonal changes that take place. Okay, so with these hormonal changes, we have the proliferation of the prostate gland, it grows larger than the normal size, and then therefore it kind of gives symptoms, urinary symptoms. Okay, with prostate health, we have to talk about two entities. We have to talk about the inflammation or BPH, and we have to talk about prostate cancer. They are two different entities. Okay. So a male individual who has a very strong family history of prostate issues, for example, his father, his uncle, his brother, and some male cousins, very close cousins, they have a strong family history. You start testing for prostate health maybe at age 45 years old. But for other men who do not have any strong family history, we can start testing for prostate at the age of 50 years old. In the old literature talks about 50 years old, and the newer literature, more recent ones, speak about 45. In some other literature, even talk about from 40 years old. Right? But the hormonal changes generally take place at the age of 50 years old. Now, what hormonal changes am I talking about? With women, you have menopause or men on pause. With men, you have andropause, which is the drop in the production of testosterone. Testosterone is the male hormone, the hormone that gives you your muscles, the beard, the deep voice, the growing of your penis, and the sexual maturity, the production of sperm. Okay? It's a natural process. When you hit the age of 50, everything drops. It's downward slope. Once a man, twice a child, you get older. So naturally, the sperm production and testosterone production drops. Okay, it's a natural process. Now, that causes different changes in the body. Scientists do not know why, but they have studied what happens at the age of 50 in a male person. Okay, the most accepted theory is that because the testosterone drops, the brain sends a message to the fat cells and also the endocrine glands to produce a synthetic or not. It's a testosterone type of testosterone, but it's not the type that the testicle produces. Or it's a type that it adds some other thing to it, some other chemical to it. That when the prostate absorbs that type of testosterone, it gets it enlarges, it grows abnormally. That we call BPH, which is benign prostatic hyperplasia, which all men have at the age of 50. Some have it a little more than others. Okay, for the normal process, all men have it. Now, if it gets to a point that the urine, the passage of the urine is blocked, then we have to pass a catheter to allow the passage of the urine. There are procedures that can be done where, for example, you have a tilt procedure where you have a scraping of the prostate, and then you can open up the passage for the urethra so the patient can urinate again. There's laser, there are all different types of procedures. Okay, there's resume, you can use the steam, the water jet energy to open up the urethra so the patient can urinate different procedures. Now, the other entity we have to speak about is prostate cancer. Prostate cancer generally affects the African descent more than the Caucasian, than the Asian people of Asian descent. The statistics show that the Asian descent have less types of less prostate cancer. We're talking about Chinese, Japanese, Asian. We can sometimes people see yellow. You have yellow people, you have black, you have white. Okay? They don't know why, it's just genetics. Now, so risk factors for prostate cancer. You have to be male, one, you have to be a man, and a female have prostate cancer. Okay, you have to be 45 and over. Prostate cancer does not affect men below 45 years. There's no statistic that shows that. Okay? Sexual activity is a fact. There's a specific virus called the human papillomavirus that I think is the type 16 and 18. I think John's Pharmacy recently, John's Pharmacy, I think it was a lab who has the vaccine, because they were advertising it recently. They have the vaccine now for the HPV. I think it's the type 16 and 18 that really produces cancer. There are many types. But the scientists have isolated 16 and 18, which produces prostate cancer. So you have generally the promiscuous quote-unquote man, macho, plenty woman, you know, good, and then the woman would transmit that virus to him. Now, the virus will not do any harm to him and in an instant. It takes years. So what it does, it lodges into the prostate, it produces chronic prostatitis, inflammation of the prostate, and then over the years, it turns into prostate cancer. Okay? So you have age, you have being of African descent, you have the human papillomavirus, then you have genetics. If your grandfather had it, your father had it, then it's like you that I have. Okay? Let's do symptoms. The symptoms in prostate cancer generally are near when it's in early stage. You might have it and don't feel anything. Most men, when they go to their general, their physical every year, they do a PSA test, the blood test, and then the PSA test is high. That's how they study it further, and that's how they find out that it's prostate cancer. Okay, so symptoms generally start later on when the cancer has already proliferated. You can have bleeding, blood in your urine. You might see often on you get a lot of blood in your urine. You might have some hesitancy You would go to your toilet, go to your urinate, and you take a little time before it comes out. You might have pain on the urination. You might find every time you urinate, it burns or it hurts a bit. You can do before you start or after you finish urinate. Okay? Sometimes some people get lower back pain or waist pain or hip pain or pain in your leg. That is very intense and it doesn't the pain doesn't decrease with analgesics, for example, paracetamol or ibuprofen. The pain is a constant intense pain that doesn't make you want to walk. Sometimes it makes you bedridden. So when you have those symptoms or you have a high PSA, PSA basically is a blood test which you do to detect any activity in the prostate. So the doctor will make you do maybe 3 or 4 blood tests or PSAs. Okay, that is the gold standard, the main test that is very specific to the prostate. So there is a contradiction with the older doctors and the newer doctors that oh, you have to do the finger first because you know the finger, you don't do the finger or you do not examine it properly. That yes and no. Okay, at the level of the health center, which is your first primary health care, where you have a general doctor, you do a general exam, right? So the finger or the DRE or the rectal exam forms part of the general exam. Because you have to check your eyes, your throat, your nose, your chest, also get your lungs, and also your DRE. But at this level of the specialist will read what the general doctor writes and make his own decision. It's his call. So generally, we send PSA, which is the blood test, and an ultrasound of the prostate. Now, with those two, you can get all information you need. Okay? Generally, we do 2 or 3 PSA, and we have all the information we need. Okay? So if the PSA is high meaning more than 4 nanograms per milliliter, 4 times 10 to the minus 9 is how small that molecule is that can be detected in the blood. Okay? So if you have 3 or 4 high PSAs, then you qualify to do a prostate biopsy. Okay, now the prostate biopsy is nothing more than taking a piece of prostate with a very thin needle and then sending it to the lab to be analyzed. Okay, so when that is analyzed, the lab sends a report where it says we detect an adenoma, carcinoma, which has infiltration, and then you have a positive diagnosis for prostate cancer. Okay, treatment options. Treatment options for prostate cancer is different from BPH, which is inflammation. So those 2 entities, we have BPH, we have prostate cancer, which are 2 different entities, but they are very common in the Dominican population. The BPH is just the inflammation, I want to specify. And the prostate cancer is cancer. They are separate. So in the BPH, the most thing you can do is when you put in a catheter to facilitate the flow of urine. Whereby prostate cancer, you have to nip it in the body, burn it or remove it before it spreads. Okay, so now 2 treatment options in prostate cancer. When you diagnose positive by the biopsy, is basically using a medication to bring down the testosterone because the cancer kind of feeds on the testosterone. So you have medication, tablets or injections to bring down the testosterone. That will buy you some time where you can go and maybe do radiation treatment called brachytherapy, or you can do HIFU treatment, which is basically sound energy that will burn the cancer. That is in a nutshell the 2 entities that I see the most in the Dominican population. Now, any questions?
We'll take questions. Yes. Thank you, Dr. Jacobs, for a synopsis on prostate cancer from a physiological standpoint, including treatments as well. What we're going to do, because we have limited time, we're going to pass on the mic to Lester Guy, who's going to walk us through in terms of the psychosocial support that is available, what you need to know. You may have gotten a diagnosis, and it's very difficult, or you may not even have a diagnosis, but you are home, you have the symptoms that the doctor has highlighted, and you are nervous of seeking intervention of a doctor and doing the regular or the required laboratory tests to confirm, and you wonder what will happen, what do I do? So how do you deal with that phobia of first knowing? A lot of people have this notion that if I don't know, then it's not going to hurt me, and they live in that almost I would call it a false sense of security, which is often very selfish. So Lester Guy, you're going to talk a little about that with us.
Hi, good evening, everyone. Thanks for the motion discussion. In fact, let me start with this is not on the video. The recent with cancer, which is not called cancer. So I know it can impact someone, someone in the family is able to get projected cancer and how to place on your mind. But let me just step back just a little. I remember some years ago, I did a presentation at Dominica district also to them about prostate and prostate cancer. And after we went through because I was with the presentation, the minister said, Mr. Guy was so happy to come about that. So guess what? I'm very happy because prostate. I remember the first time I had to do this visa examination. So I've been seeing my doctor, he was doing his examinations and so on, and he can check my prostate. It was well, I guess your that. So the doctor said to him that you have to go ahead with the examination. And he said, now someone was always telling me something, I don't want to do that and I don't have to write. The day that he did it, when he was through, he said to the doctor, I felt Father, like I'm being a confession. So much a sense of relief when the doctor told him what I checked, and it's not as large as I think, it's not as wrong, it felt good. And he felt like it's been a confession, and I laughed. I'm like, this is what I wanted to hear. And I told him one of my disappointment of the fact that he didn't say that, but he wanted me. And as a health psychologist, as a health provider, because the socio-cultural beliefs that we experience in a Caribbean setting, it's only when men, common men, speak with common men, you get the message passed over. And I keep encouraging people to have that conversation with your friends. Have that conversation with the guys that you spend on the golf table. Have the conversation with the men who's on the football team. And just so on Sunday, I was doing some home chores at the gentleman table, and he spent almost 3 hours with me because he had been diagnosed with prostate cancer and had to go to Guyana for treatment. So when we really look at it from that perspective, when we look at it from a psychological and emotional perspective, it's something that every individual is going to deal with differently. And the gentleman gave me his whole story about how to him and so on, and how his family reacted to it, and how he reacted to it. And for me, it was like really like a breath of fresh air, having someone that we not relate to so much, but felt so open, talking about it. These are the testimonials that we need. And I think these are the testimonials that are going to be very effective for the Caribbean men that we interact with. Because one of the weaknesses that we have is that Caribbean men generally, most of Caribbean men, feels that when I feel something and I can stand it and I can hold on to it, it's because I'm strong. Actually, it's a weakness. And until we start teaching that to our men, when they feel some of the symptoms that Dr. Jacob has mentioned, instead of saying, okay, let me take a little bush, let me try and see if I'll last a little longer when I'm having sex. Let me see if it will really comfortable. Let me drink water, let me drink coconut water. These are the things that sometimes we miss. And by the time we get to it, you have to start sitting there and focus. I take my time, I like helping people. But when it comes to promotion and prevention, for me, I am advocating for that more than anything else. for me, the way that we can be involved, Dr. Jacob, is by promotion of good health and prevention. Because when clients come to you and they're already at that stage where they're probably diagnosed already, it takes more work from me. I love my work, but I love people more. And for me, when you come to me and you're experiencing that, in fact, again, because I look in there, so many persons now have a discussion. Today I found out that colleague of mine also um, may have been diagnosed with some type of cancer. And the close friend of mine is saying to me, it was not a really rough day because it took a little time before that person was diagnosed. And this is what I want them to hear. Because it means that when you come to me right now, you're already dealing with the grieving, you're dealing with the loss, you're thinking of how your family is going to be sustained, you're thinking of what chemotherapy is going to be like, you're thinking of how my finances are going to be because it's expensive. So all of these other things are going to pile up with just one thing that you just take an opportunity to approach earlier Carlton would be a lot better for you. Because the fear that people have sometimes, men especially, when we have cancer, we're diagnosed with cancer, it's not only about the biological or the clinical aspect of it, it's how it's going to change my entire life, how it's going to change the quality of my life, and how it's going to change the quality of the life of my family and my business. And most times when people do come to me, if they do come to me, that's what I have to focus on more than anything else. Because the idea of the clinical care, you have to take it. You have to just decide, you know what, this is it for me to get better. I must take care of her and must do some of those procedures that you're talking about. But at the end of the day, how do I cope with it? And this is what I find myself having to do. And if every individual is different, I cannot give you a blueprint for what works for everybody. I can give you generic stuff in terms of generic stuff, so in terms of what do I do? Because when somebody presents with being diagnosed with an illness, I can walk into the steps of where do you get the support, how do you make the environmental changes, how do you make the personal changes, how do you make the nutritional changes, how do you get emotional challenges and psychological challenges and the mental challenges that you have. What it means that the way that you respond to have to decide what type of things you have. One of the things I love is that when people do come and they have family support for them, it makes it a lot easier. But once you're diagnosed with an illness, with prostate cancer, you are going to experience a lot of it. You will experience a lot of it. And that's what I have to focus on. Because I cannot pep talk you, it's not a mentorship. I can pep talk you. I can encourage you. I can guide you in terms of getting a nutritionist or getting for a doctor or medical professional that you need. But I just have to deal with what you present. So you have people who come and they don't sleep. How do I deal with that? What do I give you in terms of from a psychological point of view? How do I tell you, okay, I can give you the assurance that if and when something happens to you, your mom is going to be right. I'm not even able to do that. But what I can give you is good open mechanisms. And that's what I try to do most times, most of the time. So as I said, I may be able to be in this discussion, but I'm not going to give you a quick point. So what I feel though, a lot of people, because they do so much, I think psychological help, psychological support is really good because it helps you to cope with it better. I help you develop coping mechanisms. But at the end of the day, it's when the person comes to me in cooperation. Because I've seen fighters, I've seen persons who cancer who are really good fighters. And they're always positive. I had a very good son who was a prostate cancer, it was cancer. And that person was a fighter. But there also comes a point where the person recognizes that it's hopeless. And what I need to do is wait for whoever my dealing is and prepare for it. And also, how do I support the family members of the family themselves? So it's not just that individualized thing. Again, I see help from multifaceted. You know, the more love that we should be taking right now should not be just the client and the medical professional. It should be where all of the support comes from. Cancer Society, the faith organizations, or what will they pay in life? Because I tell people when they come to therapy, You could be Muslim, you could be Christian, Catholic. What works for you? And I will have to delve or dig into or identify where your strength comes from that needs to be counted. And that reminds me how it's not always. So I look at it from that perspective. And I encourage men, I do want to encourage before psychological help, do the promotion and the support help. But if I'm going to come to me, I will deal with from individual or subjective point of view. So we get to the
I want to ask you quickly, as we are just, or there are people who have gotten a diagnosis of cancer, and they feel, well, the best thing for me to do is to keep that diagnosis to myself and don't tell anyone about it. And the family members will recognize the physiological changes, the weight loss, the malaise, and all of that. And the person will still be in denial, okay, well, I'm just not feeling well. What do you say to someone who would have made a decision like that? I have this diagnosis. I prefer not tell my wife. I prefer not tell my mother, my sister, because I don't want to worry them. Is that um, a good decision?
So again, we have to start out again with the concept of I have been working with HIV and this response to program for 11 years right now. And there are persons who have been diagnosed with HIV and they're still denying that they're HIV positive. Wow. That's kind of interesting, isn't it? You've done blood tests for them, it's showed up that they're positive. You've done CD4, you've done viral load, and you can see that there is a virus in the system, but mentally they're incapable to accept. But denial is one of the most basic and primary defense mechanisms because we don't want to confront what is going on with us. If you look at it, this is quite an interesting thing, denial. I always laugh at it when I get clients who are denying stuff like that. Yeah? But look at it. Some people, again, as I said, it's not an impure thing in terms of because I know if I present, I tell my wife, I tell my significant other, I tell my children I have cancer. They will make a fuss over it. It again comes back to the cultural aspect of how we look at life. Because I'm supposed to be the breadwinner and the protector. If you see me as weak or as not strong, if you want to say that, it means that you yourself is going to be weak. And that happens a lot for society, where men feel that because I'm supposed to be the stalwart in my family, if I tell them that I am well, they're going to worry so much that they're going to make a fuss over it. I don't want them to worry, but guess what? Unfortunately, they will have to worry. Which is the same thing like HIV positive people. Even if you deny, and let's say you decide not to go on antiretroviral therapy, at some point you are going to get sick. So there's no way you want to avoid it. And it means that if your wife, your family, your children finds out that you're HIV, that you're prostate cancer, any type of cancer, it means that it's less than they can do. So it puts them even in a more dire situation and you have not told them early enough, which they already are mentally going to start preparing for what is the next step. Is it that you are stage 1 or 2 that we can fight it? Is it that you are at stage 3 that we know that you just have to give you as much love and comfort as you go through the process? So that's where the important sometimes is. And I really want to add mention there. This is about your life, and this is about taking life decisions. Holding on anything as relates to your health that's going to affect you long more. It's just unfortunate. And guess what? Again, I just had another friend where I clicked off this. So most people got passed on. Here's most people see us playing love. It's a very good friend of us, an artist. Very good friend who was really good with family stuff, who recently died. And again, it's just because sometimes if you don't feel well, you need to. I tell my colleagues and I tell my friends that if you're not well, if you don't feel well, if there's something going on, you need to at least have one person where you can pick up the phone and say, this is my situation. Because therefore, then comes something sudden, it's even more difficult sometimes for families than if you actually prepare for it. So we have to look at it from that perspective. And I think, again, it's just admonishing men where they are, how they have to respond to circumstances like this when they have those type of diagnosis, and still how best to get. Yeah.
Thank you so much, Mr. Kai, for such thought-provoking information. So we're going to pass on to Mr. Coffey, who is a survivor of prostate cancer. He's going to share his story with us, maybe how he got diagnosed, how he felt receiving that information, what he did, and he did from Leicester. I'm sure he could have maybe kept it to himself and keep that diagnosis, maybe kept that diagnosis to himself, or maybe share that information with loved ones, and they would have helped him. So if you're listening, as I said, you really don't want to send that dialogue go on to something else. Look and listen, you might learn something. So let's listen to Mr. Coffey as he tells his story as a survivor.
Thank you very much. Good evening, everybody. It's a very good time to be here to discuss prostate cancer and to share. During our life challenges and opportunities, we have to deal with a multitude of health issues in our lifetime. But what helps us to come out of these challenging times still stand is our faith in God, which is the most principal factor in our life as believers. Romans 8:20 reminds us that we know that we belong together for good for those who love God, who are called according to his purpose. So when cancer and prostate came calling that fateful day, it was my faith in God that I leaned on so as to strengthen my mind, my body, and my spirit as I had to face that battle with my wife and my family. Never had I imagined this would be possible after all the other health problems that I had to deal with. Cancer of the prostate made me better, a bigger man in understanding who and whose I am, and the importance of your physical and spiritual health as we grow older. Cancer, like all other diseases, is not a punishment as it can develop in believers and non-believers. There is hope in your healing and recovery, but you have to make necessary steps by yearly medical checks on the status of your health, a proper diet, an exercise plan, and of course, serving your God and giving praise. Develop that relationship with your community and your family. I was fortunate to have been checking my PSA yearly. And with my doctor, now the Minister of Finance, were able to move the plan forward in our discussions when my PSA went out of the roof. So immediately I had to begin moving pieces around to get to my other doctor in Antigua, Dr. Joseph John, then get the test done in Antigua to be sent to Miami to see at what level that I was at. When that came back, I had to now leave Dominica and go to Barbados to Dr. Jerry Emtage's office. And there the story unfolded, and then we continued. And having to face this reality took everything I had within me to steady myself. You must never second guess the importance of early detection and the value of keeping your physical the best way possible. Men, and let's settle into it, we live like these superheroes in television, but we are only human. So never live your lives for yourselves and forget your families. Because if you have to face this disease, your family is the anchor mostly. Do not be afraid, brothers, to open and be truthful of what is changing in your mind. Men, we have too much pride when it comes to a man. We think about man as if it's the first brain. But historically, this is the brain that's always the one, if we live long enough, that will shut down its business operations first. The NCDs are high in diabetes, but so too is prostate cancer. We need to live a life that considers the management system that will help alleviate the pain and suffering of these conditions and how it affects our families. The proper response is a good first step, not based on I have tomorrow, because tomorrow will never come. or when it doesn't right, it's the news that will make you feel depressed and angry and not giving to wise advice. Do not believe that there is ever moving a false paradise. Do not build your physical health on sand, but build on the solid of common sense, with knowledge and understanding of the human health conditions that can take you away too soon from this earth. The battle of prostate cancer or any cancer is won when we can change our life circumstances, when we approach the fight to prevent and it needs to be treated the cancer. Early detection is a redeeming feature that God has given us through medical science. Don't be a Pharisee of stupidity when it comes to your health. Be an apostle of common sense. I became an apostle of common sense when I realized that I could not do this alone. I did not have all the money in the world, but I chose to fly everywhere that was possible to find the best urologist. When you were diagnosed with prostate cancer, the only advice that I got was you don't just settle on one doctor. You visit multiple doctors. So in my case, I had to fly into New York and to Florida to see different doctors to decide on which of those doctors that will give me the best options that are available. And not tell you the number of the options available. The option I chose was the robotic procedure where you remove the prostate. Prostate cancer survival rate is high, but we should embrace it to get to know the signs and symptoms of prostate cancer. As other men, we need to know the rules of engagement and teach our young men whose day will come the right way of money one signs. When you feel that pain and turn of your joy or have difficulty in passing urine, please don't hide the symptoms from your loved ones because these symptoms can be non-cancerous. What is important to follow up to find out what are the causes. As with cancer, the process of people show no signs or symptoms, and the dreaded diagnosis can only be seen by a biopsy. When I felt my symptoms, I spoke to my wife. I told her exactly how I was feeling, what was happening, and I called everybody I knew within the circle that understand health. But I needed it. So I called the nobodies, I called all the doctors that I know so we can understand where I'm at. The biopsy that I did is the one that is that's the doctor really always do with the probe. When the doctor goes in, looks at the prostate and takes about 14 to 15 pieces of the prostate to put in jars to send to be tested. That for me was a significant moment. So follow up with your doctor because some of us may carry cancer genes, doctor say, through your family history. My father died of cancer of the back of the throat. My mother died of lung cancer. So I had to move because we carry a gene in our family. And obviously my risk was higher than my age. I would like to recommend that the Ministry of Health and Government continue to invest in the prevention and the detection and treatment and by so improve rates of survival in Dominica. We live in a land of a lot of dream, which is our American land. I encourage people now. So even if I am in the pharmacy business, I also look at how we can use the herbs that we have as part of the whole nutritional value of what's needed for our lives. So I engage in a number of the same remedies is the purple. I use a lot of the purple seeds. I keep using them. I use a lot of dandelion. I make a lot of my juices natural as much as possible. I walk 7, 8 miles. I try to eat the best way I can. And of course, I keep my mind occupied on the things that will keep me positive. Do not be afraid of the blood test. Do not be afraid of the practical way of checking for the enhanced prostate, which is the anal exam. I do not know why men are afraid of the anal exam. It has nothing to do with your sexuality. It's the only way that they can understand what is the size of your prostate. and what's happening. And sometimes you feel uncomfortable, but you have to face the music. Don't be afraid. These are 2 areas that can improve your chances of life. From my experience, the exam is much easier to face than the doctor informing you of the disease, which he or she is unable to help you deal with because it has spread. We suffer through this diagnosis because of the poor choices we made for our bodies. And I made some poor choices in my body. Especially when I was the young bull. We suffer from this diagnosis because our bodies are just not able to continue. We willfully become irresponsible, which usually end in our lives. We can still make money enough because God did not leave us here to suffer. That is why the reason of medical science is God's gift to humanity. And we should try to make use of this. We have to appreciate the sacrifice of our human existence. We may suffer difficult symptoms like cancer. Remember, pain, suffering, trials, and distress are all part of our human existence. When you face life-changing events like prostate cancer, I urge you to seek God's help and guidance in prayer and thanksgiving. And so doing, bring God glory to God the decisions you make in respect of your health, which you make with your doctors and your family. Cancer for me is not the end of the world. I became body changes as I grew older. As one who is confident with my own ability, I never allowed this to break me or dictate my life or make me feel less of a man. Sometimes you feel that if you have to, because in my case, I didn't choose other options. I decided that seeing that my cancer was at 7 and 8, I decided that the best thing to do is to remove the prostate. And my doctor did the robotic procedure, removed the prostate. And presently, the prostate is not available. But then there are drugs that we use that will help regenerate your nerves, like Cialis or Viagra, which can be used if you need to. The issue that I face is when they did my robotic procedure, in this sort of things that the doctors will explain to you that sometimes some of the cells drop behind. So I have to deal now with my PSC after years of that happened, my PSC number, it went up. So then we have been monitoring my PSC to see exactly where it's at. So I keep going back and forth. It is now going back down. Now we have done what they call a PET scan in the United States. PET scan is a new sort of X-ray. I can see everything. They check you if you're dying, and then they see your entire body from your head down to your toe. If there's anything, then they'll see it. That is very expensive. You have to have insurance for that. Very, very expensive. So they saw my process, they saw the area, there's nothing they're showing you. But the doctors want to do radiation, which is another cost. So if you do not take the precautions now, you may not be as fortunate as somebody like myself to be able to have the ability to go far with your treatment. I advise you to make your bodies available, make your life available for getting the early detection that you need. So we supported my loving spouse, my wife who is my everything because she has been the person. Even when I felt like I needed that boost because you go through that experience, it's not easy. I remember when we were in Barbados and I looked at my wife and one of the ways that I was able to calm myself was to play King Abstinence gospel album. And in playing King Abstinence gospel album, I was able to think of so many different things. And even when I was in tears, my heart was filled up because I'm looking at my wife and I'm saying that I do not think I want this to take me away from my life and my wife now. And I have to get the courage. She gave me that courage and drive because sometimes when you'll be amazed, the amount of things you have to get done when you're diagnosed, you're going to get bone tests, there's a lot happening. And if your family is not with you, you get lost in translation. Get tested early. So
I have a dedicated health team that is here and in the US. I've been listening and hearing, speaking to people who themselves have acted in the disease. I found encouraging support from a number of persons that have been involved in trying to get themselves better in terms of being diagnosed with the condition. Do not be afraid. There's nothing to be afraid of. The blood test. Do not be afraid of it. I encourage you to, when life faces you this changing events, don't turn away from getting to know the realities of what is happening with your body. Sometimes we, as Lester was saying, we will say to ourselves that, no, it's not me, and that can happen to me. There's some patients, just sharing a while ago, you will tell them that they are diagnosed with a problem, a condition that needs urgent help. They will say, in the name of Jesus, I rebuke the disease. In the name of Jesus, I rebuke the disease. And they never pass on after 3 years. And then when they do pass back to see doctor, things are much worse. And then the doctors cannot help you. Right? Can't say that they know the world. What is needed is for us to become much more understanding of how to battle the disease, and to get the inspiration and the hope that's needed so we will fight. Bishop Fulton Sheen is one of my favorite theological writers. I like to read about it. And so I found myself, as a result of being a cancer survivor, reading a lot more spiritual, nourishing foods, and being able to intellectually put my mind at peace. So I am not concerned about nothing more than that I am living my life knowing that it's all in God's hands. And the doctors have been given an opportunity to take care of things that they have to take care of when they are. And he said something that struck me. Those who think they are healthy but have a hidden moral cancer are incurable. The sick who want to be healed have a chance. Brothers, we have a chance for early detection. We have a chance for wise and prayerful decisions based on the Holy Spirit and on medical science. Get tested. One of the things that I noticed even meeting people overseas in clinics is our lack of faith. We still believe that we can do it by ourselves. I encourage you to get tested and stay strong in Jesus. Cancer may put you in the spotlight glow down. You will not see the struggles that you face if you do not go and get tested early. And the lessons will be learned, but the struggles are real. It's affecting you and your family. Fight for good health, wisdom, courage, and mind. So that you might live to live a long and fruitful life. Prostate cancer is a significant health concern worldwide that deserves our attention because we are the leaders of our households. We are the fathers. We are the builders of the nation. Understand the risks of silence, the dangers of silence, and inaction in the face of a disease because we want to protect our manhood. Early detection will help the health system see better health results for us men. The outcomes will be better for not only Dominica, but the world. May God continue to bless us all now and forever. And may every man listen to my voice who has the prostate. Harden not your hearts. Go get tested.
Well, thank you so much for such a heartfelt deliberation. I felt it. I think that the information you gave was one that was quite applicable and relevant for all of us who would have listened, those particularly who are above the age of 40 and would have maybe have never gotten tested, will now see the significance for the need of having your prostate checked. We will now open the floor for questions. If you have any questions, I saw someone ask online. They were discussing or making statements regarding agricultural products, such as pesticides and so forth, and whether it is a factor for the spike in cancers that we see.
The answer to that question is yes. A lot of the pesticides, so the fertilizers that we use, also the plastic bags and plastic containers that we use, Tupperware, especially when we microwave or food, we warm the food in the microwave with the Tupperware, those things leach chemicals into even the water bottles that we use. When it stays in your car, it stays in somewhere hot and humid, the plastic leaches chemicals. So yes, it was correct, especially we currently beat out of a broad region out of tubers or roots, and we tend to use we call malathion, all the chemicals, bromoxone, Roundup, all these chemicals that we use for pests and also the fertilizers. They tend to enter into the meat, ingest these things, and these chemicals they build up in our bodies, and they are they call them hormone. They mimic the hormones. They have the chemical. They mimic the hormones and they fool the body. The body thinks that they are chemicals and they cause a retardation of the prostate. They cause prostate and cause prostate cancer. These things are linked. There's a study you can actually look it up. Marketing has banned all of these fertilizers from the early 90s and 80s. They do not use these things. I guess, well, I was speaking to someone from there and said that the soil is basically contaminated. I think that's why they banned it. So they have, just like us, they have a very high incidence of prostate cancer. And some research links those chemicals like spreading bananas with to the high incidence of prostate cancer. You can actually type on Google Martinique and prostate cancer. Also, you can type fertilizers or pesticide, and the studies will come up. Okay, I think in Dominica we have the same. So your business correct. There is a link.
Thank you for the panelists and for your presentations. My question is directed to you, Dr. Jacob. I wish you would expand a little more on the treatment for prostate cancer. I have understand all of you want to emphasize the importance of the detection. And I ask that because I was diagnosed with prostate cancer myself, and I chose to do brachytherapy. My eldest brother was also diagnosed with over treatments. My second brother also diagnosed with a variety of prostate. And I have three nephews who have already been diagnosed with prostate cancer. They're all survivors. So if you could explain more into the treatment. The other thing I want to ask also is that I thank God that I have insurance. That's the expense of it. And to share that as well, because one thing to say that yes, you're detected early in the habit, and you can get treatment that can avoid it. And is there anything in place for those who will not be able to avoid it? I know that years ago we had our own Bishop Bola was diagnosed with cancer, and we established a fund for those who would be able to access that fund so that they could be treated. So if you just more about that, I think that would that information is important for us, for all the entire public to know that not only is the detection is important, but then when I'm diagnosed, how do I go about getting treatment?
Very good question. And someone was asking the same question online in terms of financing. But yes, one person could have access to insurance and so on. But what if you don't have? What are the options that are available?
So that's quite a long question, but it's a very good question. Yes, treatment options for prostate cancer. So, okay, so you diagnose with prostate cancer. The only diagnosis that stands as the legal diagnosis is a positive biopsy. Okay, so there's no PET scan, no CT scan, no ultrasound, no scan can really legally say you have cancer. To say you have cancer, you have to have a biopsy. Okay, nobody can ultrasound and say, I think it's cancer. You have to have a biopsy. And most times in the biopsy, okay, just to recap, the biopsy is we take a piece of the tissue from that organ we study. So there must be a piece of that tissue that is sent to the lab, a piece of that organ taken, sent to the lab to study. When it's studied, I mean, it is looked at under the microscope. So you have a little slice of the tip of the organ that is sent to a lab, and this slice is examined under a microscope. So under the microscope, it is stained, it is prepared. So it is stained, it is prepared. Sometimes it's stained twice or three times. Stained means it is a dye. Okay, it's cut, stained and then it is placed under a microscope, right? High resolution microscope. So what the pathologists look for is they have a band, they have an image band where they compare that image, which is the slice of your organ, in this case prostate, and they compare it to the band where they have many images. Right? So you have three, for example, you have three cancerous lesions. They look at three cancerous lesions, they compare them. So they look at stage 1 prostate cancer, they compare the band, they compare. Stage 2 prostate cancer, they compare. So all images they compare. Now cancer is, I would say in the layman terms, in the period by growing of the cells. It is very abnormal. There's no order. So you have a tall cell, small cell. Other people are same one of them. It's not like for the police officers or the scouts, short is to the, there's an order in it. Understand? So generally you have cells of an organ. There's an order, there's a different order, but with cancer, there's no order in the growth of the cells. So you have the growing disorder. So the amount of disorder you have is the staging level, stage you have. So if you have very high disorder growth, you have maybe stage 4 or 5. If you have a little disorder, you have maybe stage 1. If you have an intermediate disorder, you have stage 2 or 3. So that's how they grade the cancer. So the biopsy will give you an idea of how the slide is seen on the microscope. The biopsy can also give you an idea if around the prostate, it's a free, they get little pieces of little cells of tissue in the capsule of the prostate. The capsule is like the outer part of the prostate. So then when you see you have capsule infiltration, you know that's already on the outer edge of the prostate. So with the prostate is an organ, it's not circular, but it's oval shaped, like a small line, but then you have lobes inside of it. Okay, so you have stage 1 prostate cancer, where it is in one lobe, right? The lesion in one lobe. You have stage 2, where it is in one or all the lobes. You have stage 3, it is on the capsule, which is the outer edge. So let's think of a grapefruit, where you have stage 1, where the cancer is in one peg of the grapefruit. Stage 2, where it is in 2 or more pegs. Okay? Stage 3, it is already on the skin, what you peeling when you peel it. And stage 4, it is out of the skin. The most common testing goes the lymph nodes. The lymph node, you have glands there, the glands there, lymph nodes, and then you go to the bone. It latches onto the bone. And the closest bones are the pelvic bones. That's why you get waist pain and back pain and lower back pain. So that's the easiest way of describing stages. Now, depending on the stages you have different treatment options. So you must understand the stages so you get treatment options. So stage one, okay, before you go to stage one, there's a stage called precancerous lesion. A precancerous lesion, or PIN, we call it, is you have some inflammation there, but then it's not compared to the image map, it's not cancer yet. So some men, they would say they get a precancerous lesion, but it's close to cancer, but it's not there yet. So you're going to have to repeat the biopsy in a year or two. So you have that, you have the precancerous lesion. Then you have stage one. You have it in one lobe of the prostate. Okay, in stage one, generally, you can do radical prostatectomy, what my friend here did, what he did the robotic. So the radical prostatectomy is just to remove the prostate completely. Okay, now stage two, where it's in 2 or 3 lobes, most likely what we do is the brachytherapy, which you mentioned. Brachytherapy is the radiation therapy. Now, radiation therapy is either generalized radiation or localized radiation. What we did, I think, was the localized radiation, where they have radioactive seeds being implanted into the prostate. Okay? Now, they have radioactive seeds being planted into the prostate, exactly where the lesion is, with guided by ultrasound, high intensity ultrasound. Okay, so that is what we did the localized radiation with radioactive seeds, and then like small grains of rice being implanted. Okay, stage 3, basically palliative care. Palliative care meaning you can do hormonal therapy when you give tablets or injections to decrease the production of testosterone and help prolong the person's life. So then after stage 2, anything after stage 2 is basically nothing can be done really. What you do, you just prolong in life, even palliative care. So that's why early detection is important. Because after stage 2, that is 1 or 2 lobes, 1 or 2 pegs of the grapefruit already. That means it's very difficult to control. Right? Stage 1 is in 1 peg. Right? Stage 2, 1 or 2 pegs. Stage 3 is on the edge of the skin. Stage 4 is already past the skin, going. Stage 5 is in multiple organs. Stage 5, like the brain, the lung, the bone, it's already multiple organs. Okay? So in Dominica, I offer treatment, palliative care treatment. Like generally, we meet patients who are in stage 3 or 4. Most times we meet the patient with a PSA of 500, a PSA of 200, a PSA of 100. I've seen PSA of 1,000. Once the PSA is over 100, it's already spread to another organ. So it's already stage 3. No doubt about it. A PSA of more than 100 is already spread. More than stage 3. So there, with palliative care, you give hormonal treatment. These hormones will bring down the testosterone and start the prostate cancer as much as possible. Okay, because the cancer eats testosterone, so you have to bring down the testosterone so you can prolong the person's life. So from stage 3, going is palliative care, prolonging life. Okay, the treatment in Dominica, I was just speaking to Mr. Coffee. I generally use beta-glutamine and androgen. I use them both. And the cost is about $300 and something for 1 treatment. And I was just speaking to him about we can maybe do something to bring down the cost because sometimes patients can't even afford it. The other treatments are in the hundreds of thousands. Okay, so I'm talking about US dollars. So it's expensive. Robotic therapy, you have to have insurance. Yeah. Robotic radical prostatectomy, the robotic one, is quite expensive. The radical prostatectomy, if you go to a surgeon, you're in the Caribbean, maybe you can get it done for 80,000-90,000 EC if you have a good relationship. But if it's in the US, it's hundreds of pounds. Okay. So the treatment is quite expensive. You have to have insurance for treatment. The cheapest treatment we have here in Dominica should be about 300 and some, let's say 400 a month.
It's all of it.
Zoladex, yes. Zoladex,
About 1,500.
yeah. So then I need stop Zoladex also. But for the patients, a lot of them cannot afford the Zoladex. Zoladex is an injection which is subcutaneous. It goes in the brain to bring down the testosterone. So I'll mix it up. So I'll give them every 3 months the Zoladex. In between, because it's a mild androgen. And that helps a lot because it kind of it prolongs it like just enough, maybe I would say 5 to 7 years, which is a lot. Okay, but from that, there's nothing more we can do. You have to go overseas. Okay.
I wanted, because we're getting some comments online as well, I want to acknowledge the viewers. We have Dr. Adrian from Antigua, who is also a consultant urologist with us. And I just want to kind of give Dr. Jacob some help with his voice. Dr. Adrian, you practiced in Antigua. You can let us know what you asked to what you say in Antigua. But I wanted to focus a little on nutrition. There have been a lot of talks about red meats and dairy products attributing to or as a risk factor for prostate cancer. Also to men who have a lot of sex, there are some documentation that are saying that it reduces the chances to prostate cancer. Is that a fact? Is that a myth? So these are the two areas that I want to focus on.
Thank you for those questions. Good job. Stimulated so many questions. I wish I could talk to you guys all night about this. I was first in there. I have a lot of experience with prostate cancer and Chico, Barbuda, here in Dominica, Montserrat, Jamaica, the UK, Africa. This thing is very bad. It is killing black men. We don't know why, but we are on at risk. I saw on the brochure it's printed, you said 1 in 9 men get prostate cancer. It's actually white men. 1 in 6 of us will get prostate cancer. So I was collecting a number of men in here, and I was going to say that at least 2 of us in here will get prostate cancer. And they've already raised their hands and told us that is how serious it is. No, we don't know why. Unfortunately, there is nothing that we can do to prevent this. We're in a state where the best we have is early detection. Compared to the experience in Antigua, I do both public and private practice. And I realize we're speaking a lot about the having the problems and not going to the doctor. So they're having to pay, they're struggling to pay and fighting. That is very unfortunate because most prostate cancer is around when you have absolutely no symptoms. I'm sure you can imagine that's when you want to be diagnosed. If you have to get prostate cancer, you cannot prevent it, you want to get checked. Now, in my practice, the emphasis is on early detection, wellness. So when I came back, it was all about prostate. But then all the men were coming in sick with hypertension, diabetes, stroke, every problem. So I can't even fix your prostate if you're not well. So the emphasis has now shifted to wellness checks. Don't wait until you're feeling something. Once a year, around the time of your birthday, you go and get checked. Okay? That is how we pick up things before you move on. I like to tell the men how many times a year you service you have. 2, 3, 4 times a year. So can't you go and service your body once a week? And that kind of gets them. And then we have to change the culture to get them to be aware of their health, aware of their body, and to take care of themselves. If we are waiting until we are forcing them to come in when they're sick. No. I had questions for each one, and I'd like to find out also about the biopsy issue because I suspect the figures you quoted are very, very, very underreported. And that situation right across the region. I'm sure it is very difficult to get a biopsy in Dominica. And if that is the case, legally, you guys will not document that as prostate cancer. So I'm sure in your practice, you have lots of men walking on PSAs of 200, 300, 500, and do not get the biopsy, so they do not go to the ministry's count. That's the same problem. The basics. There's lots happening with prostate cancer, fancy treatment, robotics, genetics, but we can't do the biopsy. We're the same. What you wanted to find out about nutrition.
Yes.
So there's a lot in the world of nutrition, and we're at the stage where we're all about evidence-based medicine. Lots of people have different opinions. Now, from an evidence-based standpoint, there is information suggesting that processed foods, bread, fatty foods are bad for us in terms of all cancers, and the natural foods, the plant-based diets, the fruits, vegetables are better for us. The irony is, I'm sure if I ask you that, you can tell me that answer. You know what is good for you. Most people know what is healthy for them, but it's easy to get, it's accessible. Everybody is busy, no one is going to cook for themselves. They're going to go and buy food at the shop, they're going to buy fast food. And unfortunately, the unhealthy is cheaper. But these are the things that we have to do, both for the men and for the women, to keep us healthy. You also mentioned, you asked about the issue with sex. You know, it comes up a lot. Once upon a time, we used to say that if you do not have sex, you get prostate cancer. But very recently, a study came out and said that if you have sex, or if you ejaculate more than 21 times per month, it reduces your risk of prostate cancer significantly. So that got a lot of the men inside. So you know, the woman inside, if I have sex, you give me more sex, I will get prostate cancer. That's what the data shows. It didn't say just sex, there was ejaculation, choose the masturbate. It should lower the risk, but that is what the evidence shows. Obviously, we would like to see more data to confirm this, but as scientists, we're scientists, we need evidence to get. Can I ask him a little bit more about how easy it is to get biopsies here?
Okay, in Dominica, it's a difficult thing. First of all, when you go the public route, which is the hospital, there's a long waiting list, right? And the waiting list is because of the lack of staff. There is one Chinese relatives there who is overwhelmed. And then if you want to go the private route, where I do biopsies, it also there's a so medicals, we does biopsies and this very relatives. Okay, but it's private, okay. So those who have the funds can get it done relatively quickly in a week. But those who do not have the funds to go the private route will have to maybe wait a year to a year and a half in the waiting line to get it. Okay, that's how people go.
Do you have any cancer registry to document the number of cancers you have?
We don't have any money. So that means if you want to access and get through the public health system and you want to go to the police, you should have some information in the back when just started. There was this oncologist from India who was doing quite a lot of cooking and very good work, and he is the one who kind of opened and then we are talking about because when you go to the policy manager, you're seeing like a fact chat just to we end up in the more cases and cases that so there should be some.
Dr. Dominica is not seen at all. Dr. Dominica is not seen.
You're supposed to get from Dominica.
There was also some information about Yeah, someone was saying that there are a few cases where people develop prostate cancer before the age of 40. Yes, so that was the comment. So, yes.
So unfortunately, these patients don't read the textbook and anything is possible. No, from everything in health is a risk-based assessment, a risk. No, generally they say if you're a white man or have no family history, you start checking age. But black men, all of us, or if you have a family member, father, a brother, an uncle, or if you have a woman in your family with breast cancer, there is a reaction start checking at age 40. That's why most of the guidelines, particularly for black men, recommend, and even regional guidelines recommend age 40. No, it's not impossible to get cancer at 39, but it is extremely rare. We don't tell all men at 30, 35 to go and get screening. We have to determine when to start. So statistically, 40 is the age that I use in my practice, and most of the regional neurologists use. Unfortunately, too many men are coming in at 16, 17. And these are the guys that are coming in with PSCs of the 200s, 300s. What we're trying to push, what we're trying to advocate for is young men at 40, 41, come, you get a PSA check. And don't only do the PSA, but you do the blood pressure, you do the cholesterol, you do the sugar test, because you want healthy men to keep society going. Unfortunately, I find society has a lot more symptoms. I'm sure this is a breast cancer forum. I'm assuming this will be still probably starting to only if it was a pediatric situation, this room would be filled. You ask for a donation for the women, for the kids, money is flowing. Once you start talking about men, they're not taking care of themselves, they don't care about themselves, they're not interested in their life. When really and truly, your 60s is the most productive years of your life. You have lived, you have experienced, you have contributed. This is when you need to be living, and society just has not caught up to that. So the focus personally is to shift to the younger guys looking after themselves so they can live longer and fulfilling life.
Another question that's coming up is certain occupations does that increase your risk? I know but there have been some documentation related to cycling and prostate cancer. Yes, cycling and prostate cancer. People who do driving, like truck drivers, who drive for extended periods of time. Um, uh, does that certain occupations does that increase? Are there certain occupations that increase your risk to prostate cancer?
All right, that's a good question. For prostate cancer specifically, no. There was a period in time where it was thought that cyclists had an increased risk of prostate cancer. It was spoken about in the media that has been debunked. Drivers, that used to be spoken about in the media that has been debunked. That does not increase the risk of prostate cancer. But your occupation as a man can increase the risk of certain cancers, particularly what we see is bladder cancer. So people that work in pesticides, people that handle a lot of chemicals, dyes, that sort of thing, increase the risk of bladder cancer. From an occupation standpoint, hairdressers, if you deal with clothing dyes, hair dyes, that increases the risk of bladder cancer, which is very close to the prostate and increase the risk of kidney cancer. But if we're still talking about prostate cancer, nothing occupation-wise increases the risk. Genes, being a man, unfortunately being black, being black, right? Risk family, these are the things. Other things like diet and so forth, lifestyle lower down, but those are the things.
Another question that is coming up. Might be a little sensitive, but transgender. So if somebody is transgender as a man, changes his identity, is that would he still be considered at risk to prostate cancer? Any of the doctors?
It's a very good question. So, the whole transgender movement has brought about quite a lot in terms of prostate cancer, a lot to think about. Now, it depends on what kind of transgender, what procedure they had done, and what are they from a man to a woman, etc. So if it's a trans woman to a man, so the person is genetically female, they will not get prostate cancer. Okay? They do not have a prostate, their genes, their chromosomes are XX. They have never had a prostate, they don't have a makeup to have a prostate or prostate cancer. They will not grow a prostate related. Where the problem arises is the men that transition to females. They can do everything externally to look like a female, but they still have a prostate. So they can get prostate cancer. Now, if the clinician is not aware of that, or they do not exist in a society where they are open about that, so they move to somewhere as a woman, and treated as a woman, not with their PSA checks, they can get prostate cancer. Now, depending on what surgery they did, they may have had some of the internal organs removed, including the prostate. And these are all very important things to know to assess prostate cancer risk in transgender patients.
Okay, so we have question here.
This question is for Dr. Jacob, possibly Dr. Bradley, somebody contributed. Dr. Jacobs, you mentioned in the presentation that there is something called a precancer lesion, right? That may be a precursor to cancer. Now, my question is a lesion definitely an indicator, that one is going to get cancer? Secondly, if this is the case, then is it not possible to do something about it at that stage?
Okay, so yes, the precancerous lesion, that is said, or this is given by the pathologist, who is the person who really looks the sample on the microscope. I would describe a precancerous lesion to my patients as a lesion that is very similar or very suspicious, but it is not quite yet able to be defined. So you have to do some watchful waiting or just observe it by continuing doing your PSAs and maybe in 1 year, 6 months to 1 year, repeat the biopsy. So the lesion is something very suspicious. It's a lesion that is suspicious that the pathologist cannot really get finger on yet. They cannot definitely say it is stage 1 or stage whatever, Gleason score or whatever. It is just something they have to keep monitoring. Okay? As to what you can do to prevent it or reverse it, not much. You have to take on and watch the way, observing and repeating the PSA over time and see if the PSA rises or it stays the same. And within 6 months to a year, repeat the biopsy. Nothing much you can do, just have to observe it. Make the doctor 1 to 6 months.
So I agree with that. You see, in life, unfortunately, it's not always black and white. You sometimes have gray area. That's what these pre-cancerous lesions are. Now, when you get the results saying pre-cancerous, remember when you did the biopsy, we took 12 samples of the entire prostate. So does that mean you missed the cancer? And that is one of the considerations. So the concern is how this precancerous lesion, when they looked at some of them, what they have found is that sometimes this precancerous lesion sits right beside the cancerous lesion and we missed it. So what they have found is, depending on which of the precancerous lesions, they found that if you rebiopsy them again in a year, you then pick up the lesion, you pick up the cancer. And then some of them you rebiopsy the year and there's no cancer. And then they have ratios of percentages. So we generally use that to then say, look, it's not worth me treating you for cancer yet, but let's see what happens in a year. And then we opt to rebiopsy in a year to say, yes, there's cancer, let's move forward. But the worst thing because the patient is stop checking. Because I have patients that have gone to this income, pre-cancer treatment, have disappeared. And then we come back in 3 years later with PSA. That is happening.
Let me add to that. So generally, when you get a suspicious lesion or precancerous lesion, I would say the same thing, wait, but then I would also add, you can get an MRI done. So generally, the MRI is magnetic resonance imaging, which sees very, I would say, the smallest image, the smallest lesions, up to maybe 1 millimeter thick. So in that case, if there is something growing or something coming out or something just hiding under the roof, so acutely, then it will pick it up. So the MRI will pick up very small lesions of the 1 millimeter wide or thick. So if you have something there, it will be developed, most likely. So if you have a precancerous lesion, I would recommend an MRI within 6 months of the prostate. That will help. So because most patients are afraid to go at the time because it's uncomfortable, it's like painful. So I would just say, we'll try to do the MRI done, and if anything is there, the MRI will see. Okay?
But the MRI does not replace the biopsy, right?
No, it doesn't, but it gives a better idea. Something is linking in the back. Understand? Yeah.
So we are just about out of time, and I must say that it was indeed. We have yes. Your question.
Thank you, Mr. Moderator. You were saying that 1 seat in this room that you expect one seat or food. So, yeah, I was diagnosed with prostate 2 years ago. And like Father John, I had Rocky in my ears. The question that I would like to ask you is directed at Lester. We heard from the minister, we heard from you, and to some extent from Dr. Roy, that men generally see it as a weakness to come forward for support, medical or social, even less so. I mean, even this evening, when we see the numbers here, we could do better than that. My question to you is, based on your experience working with HIV patients and others, what more can we do to get men to come forward and talk about what's happening to them? That's the question.
Wow. I know that has been one of the discussions that have been had so many times in the courses. I will tell you, it's a mindset change you have to hold on. And see how I've tried to approach it. Recently, we were trying to do a toolkit for teachers to primary and secondary school to deal with stigma and discrimination. So it means that the whole discussion of sexuality, stigma and discrimination, everything would have been introduced to the children as early as possible. One of the struggles that we have, the challenges that we have in parenting setting, I do say parenting setting because I interact with so many of my colleagues around the region, or in America, I should say, is that our girls are introduced very early to health. By the time they get a period, you have discussion of their pregnancy and the menstrual cycles and so on. Young men are not affording that. We only go to the doctors when we have a problem. So what can be done, Mr. Lina, for the general public, is to have introduction of health promotion within the private school. In fact, you can even start from kindergarten. In your syllabus, you put something that allows the children to have already been introduced to the topics. So as they get older, you give them more information and they're more acquainted and aware of the information. And that's the only way it's going to change. Because we have a mindset already within our culture of men not wanting to go to the providers. But if your boys, when they fall in the
those the needs, you tell them, don't get up and don't cry, no, you need to go to the doctor to make sure it doesn't get infected. That's how we're starting the process. So right now, they don't take it for granted that when they get a bruise, that I'm a boy, I'm supposed to cry, let me just wash it in water and launch it. So that's one of the things I think we should do. Make sure that within our educational syllabus, introduce young men to the topics of prostate cancer, sexuality, sexual behavior, sexual health. So as they get older, they're already aware of the subject and they feel more comfortable talking about it. That's what I should do. In addition to when the doctors were talking about, we had this whole thing over telling me that if you ejaculate like 20, 21 times in a month, give them a good message, but you get educational message into not just ejaculation. Go check yourself. Then you're giving them a message that is, yes, I want to have more sex, but I know it's not just only sex that will prevent me from developing prostate cancer or any prostate issues. It will mean that I have to do other things, which is the same we do for sexual reproductive health. Yes, I tell you, for example, we use the ABC system in sexual health and sexual protection for STIs. We do push abstinence A. B, be faithful if you have a partner, don't have multiple sexual partners. And then we talk about if you have multiple sexual partners, you start with the condoms, you do a test, you can educate yourself, which brings you down to the CDMA. The same thing needs to be applied. Give them the basic protection message, and then add other things to it. That will make it a lot easier. And it broke my heart. I will tell you, it broke my heart when I wanted to have this toolkit developed that young children will start reaching the subject. So by the time they get to high school and they get to college and university, they're comfortable about talking about those things. That's the only thing that's going to change the mindset of our many in the Americans. Until we do that, we're going to have the same problem.
But I just want to add to that. I mean, sports is one of the areas that is very appealing to boys, young men. And I think in our sports program, that we must get sports psychologists, psychologists working in the area of sports so that our sportsmen can have those opportunities to talk to these individuals. And this is where we can get them to be more open about not just health matters, but many other matters that affect them.
Let me answer that for you. Explain. Well, I'll tell you what. With China, the men don't show. Men don't show. Recently, together with Kariman, I think during the same time last year, we had a health talk where we invited teachers, sports organizations, fitness organizations to come and have a discussion on gender-based violence. Let me tell you, it's only people who are part of the table and a few scattered men were there. We have to end up just having a round table discussion. They don't want to come because what you can do, I can suggest, and I've seen it before. I remember there's a program that I did called with Kariman, that was called Ghana, to achieve or to earn. You use sports to teach young men life skills. You can also find a way to develop structured programs or structured projects where young men get the opportunity to do sports and do things with fun, but have educational sessions in it. Even myself, one of the things that would be so disappointed about is when I just came out from studying, St. Mary's Corporate Curriculum, which I'm part of. We organized that. We sponsored the football team in my village. And outside of football, we have had persons come in and have discussions with young men who have issues, on life issues. And you set it up. You get the person to come, tell the person to pay them. When you come, young men don't show. They don't, unfortunately. So you have to find more innovative ways, Mr. Minister, to find those information too. And the only way I think we can move is when you have structured programs that catch the children as soon as they enter the education system. That is what will make a difference.
But that's what I'm talking about in terms of sports psychologists, because I'm talking about sports because sports is very good. Integral in its own curriculum. What I'm saying, in addition to the sports, the sports teachers, that you need to bring in those psychologists to move alongside so that, and I mean, a lot of the tournaments that we have going on, have coaches, yeah, invest in the coaches, but we also need to bring those other skills on the field.
Yeah, thank you so much, Mr. Lita, and to our really informative panelists. We really want to thank you, Dr. Ken Jacobs, urologist, Mr. Lester Guy, psychologist, Mr. Valentine, common businessman, survivor, and Dr. Adrian. Right. Lord, right. Okay. So that's why I'm gonna put it. We very much thank you for contributing as well. This evening. At this time, I am going to turn the mic to my good friend, Dr. I say Dr. Gregory, an honorary Dr. Lee. Worked so hard this month, getting the message over here from Bethany to St. Joseph to Marigot, all over the Is it done correct? Yes. Thank you, Mr. London. There's not much to say again, but to recognize the panelists and to say how much we appreciate the sharing of your experience, your expertise, and your life stories surrounding the topic, Okay, so let me thank first of all the Minister for addressing us here tonight and to outline the policies of your ministry. We at the Cancer Society, we work very closely with the ministry. In fact, this month is Caribbean Health Wellness Awareness Month, and therefore we had collaborated efforts in Granby, as Carlos said, Granby, St. Joseph, Margaret, and other institutions like the prisons and stuff like that. So we are very thank your ministry through you, and we want to continue working with you. My group, let me see, my mentor, my pastor, my guide, my former teacher. I want to say thank you for your prayer in all things, and the pastor, friend, or you call it sort of anyway. Yes, I said it all that we must put God in all things we do. Give God the glory at all times. Father, the reason why you're not hearing from me, my phone doesn't work. I can't send one message. I'll get you that. Thank you. But yes, the inspiration part of it is very critical, and we thank Father for reminding us of that. Dr. Ken Jacob is becoming an integral part of our promotion and our advocacy and our awareness programs. We call him, whether it's a talk show, whether it's public meeting, community hall meeting, he's always willing and ready to participate. So we want to thank you, Dr. Ken Jacob. Valkov is my friend, my neighbor. We go a long way, and his story is inspiring. I think we need to root you and take you on board so that you can do some more testimonies with the Cancer Society, especially care of men. So thank you, Mr. Coffee, Reverend Coffee, Deacon Coffee, Young Wood. Lester Guy, I'm really impressed, very impressed with Lester's presentation. And, it's a pity we don't have the kind of crowd that we anticipated. But more men would have come on. But I'm sure they're listening for the social media platforms and carry live streaming. So I really want to thank Lester for that presentation. And then we had a surprise panelist who is Orlando, Dr. Adrian. Very inspiring. Your
your experience and bring it back. We thought we had a problem in Dominica. Apparently, it's in the Caribbean, it's in the OECS, it's in the Americas, as Lester pointed out. So we really want to thank you for your intervention and your contribution. Right? And probably we should get your contacts. So we at the Dominica Cancer Society can raise with you and see how we can best collaborate when we have programs. September is coming to an end, but I think programs like that, Mr. Rita, we to continue it, bring them out of Roseau, bring them to the communities, with panelists and expertise like we have on TV right now. To the media, I want to say a special thank you. Kyrie has been on board. So Kyrie is a member of the Dominica Cancer Society. See that is a member. But I also want to thank DNO and Scotus and Stem Williams. Civic Vibes. So I want to thank you all for helping us to bring the message across to the virtual audience. I'm sure we have a lot of followers virtually. And also we want to thank you for tuning in to our program this evening. Our next big activity will be the Cancer Walk, which comes up on October 6th. And we're going to be starting from one point, the Roseau area, that is, we're going to be starting from Cave Field, from the Roman Catholic Church around the NPT Bank to Cave Field on October 6th at 4 p.m. and we're going to walk towards before court in the stadium, or in the stadium where we'll have some addresses, some entertainment, some testimonials. So we're hoping that the general public will participate, will patronize us. We'll have sheets available for contributions that we will. Also, simultaneously, we're going to have a walk from in the north that is possible from Purple Turtle to Benjamin's Park, beginning at the same time. So that's the simultaneous walk. And we're asking for the general support. Our t-shirts have arrived and they will be available, let me see, by Friday, not Friday, Monday for sure. Because when we receive the t-shirts, we have to stock them out by sizes and by orders and stuff like that. So let's say by Monday, we'll have our t-shirts readily available for the walk. So please purchase your t-shirts in bulk. And also, please donate. Where's the cash? Now, I want to really thank the Master of Ceremonies, Captain Mando, and one before the last, for doing an excellent job. Time management, as usual, is on point. We decided to end that before 9, and we well into that timetable. Right? So I want to really thank you. Mr. Mando is no stranger to public awareness and public health awareness forums. So I give him his kudos, being an expert in that field. And also a coordinator, men support group. He has been working hard at this Mr. So we really want to thank him also for bringing our prostate one to a success. Don't mind it to know this role, but I'm sure persons are following online and with the help of the media, we will get more exposure during the week. I'm appealing to Mr. Durand, Steve is already planning to repeat it, so I want to. And Loftus also. So I'm sure we're going to get some media coverage as it goes along. And as I said, we're going to be having to plan beyond September to do more of that kind of program so that we can get the message across. I also want to thank UE for coming on board with us again. UE is one of our partners, and I really want to thank Dr. Joseph for all the facility to have this program here tonight. And the caterer, we have some soup available, so when we end this discussion, we'll have some refreshments inside that we can partake in. And finally, I want to thank the President of the Dominica Cancer Association and Society, the board of directors, our volunteers, our support group, for keeping the fire ablaze. You know, it's not easy, but we want all of us are volunteers, we're not getting paid, and so we could have been using our time to do something else here. But we are here always volunteering, and so we want to thank all of our volunteers. And finally, I want to thank God for allowing us this opportunity. This opportunity for us to gather here and share the information. To God be the glory all the time, every time. I want to pass back on to Mr. Coordinator, Mr. Vita, for presentation of some fruit baskets to our panelists. So, Mr. Vita will be on that. Yeah, the challenge is for us to try to attract men to this forum. So the first one goes to Mr. Lando.
Peace.
Right here. Mr. Lando, we have the Cancer Society, you accept our token of appreciation.
Thank you, sir. Thank you very much.
Let's say anything. So, second one is thank you so much for your contribution. Mr. Van for the first one. We'll have to get a special token for Dr. Adrian because okay. When are you leaving? We'll organize to get to a special souvenir or something. So, Dr. Jacob.
And we'll be free to
Thank you so very much. So before we end, a reminder that our t-shirts are going to be available by Monday. And also our caps, you see, we have caps, right? Attitude is all. It's everything. It's a leadership is everything, but if you got your own attitude, leadership doesn't matter. So get your caps, $30 for one, and the shirts are $40. Check our office for more information. So again, I want to thank everyone for tuning in and being part of this panel discussion. And I want to wish you well. Travel to cities as make your way back home. Thank you very much.
And thank you very much, Don, for thanking us and as Don indicated, we have some refreshment for you, so please take something with you. Thank you, and have a good night.